back on the floor to you.
Thank you. Well, I just have to say my day is made that the Pew Internet data actually matches with the DC provided data because when you're a survey researcher, you really hope that it's accurate and useful, but to have an example where it truly is accurate and useful is really wonderful. So thank you very much for that gift. So let's benchmark where we are as a nation. 79% of American adults have access to the internet. 63% of adults have broadband at home. 56% of American adults have access to the internet wirelessly. And in that definition we use a laptop, cell phone, MP3 player, or a game console. When we include mobile access in our definition of the internet user population, we actually see that the differences between African American adults and white adults is erased. We're really seeing a difference when we include that mobile access. And what we're also seeing, since the Pew Internet Project studies the social impact of the internet, not just the uptake for internet access, we see that in politics and in healthcare, especially, participation matters as much as access. Technology can enable the human connection, creating opportunities for people to gather and share information and to solve problems together. The passion that we saw in the political campaigns last year is matched by the passion that someone feels when they're trying to save a life, to find a better treatment, or just care for someone in the daily grind of having a chronic disease. It's still early days, but the evidence is coming in that patients can contribute to drug discovery. We are seeing evidence that there can be better health outcomes because of patients collaborating with health professionals in what's being called participatory medicine. In our survey data, we find that 42% of all adults say they or someone they know has been helped by following medical advice or health information found on the internet. That's an increase from the last time we asked that question in 2006, when 25% of all adults said that. We asked the opposite question: have you or someone you know been harmed by medical advice found online? That's a flatliner at 3%, both in 2006 and in our recent survey in 2008. So with the good news that comes from that data, I also want to remind everyone that we don't have full participation. While mobile adoption is creating greater access and participation among African American adults, for example, there are other groups who remain disproportionately offline, such as people living with chronic disease and disability. They may be missing out on opportunities, but just as importantly, we are missing their voices in the conversation. Keep your eye on mobile adoption, since always connected citizens are likely to be at the forefront, navigating the new healthcare delivery system and taking advantage of opportunities for political participation. What we see in our data is that mobile could be a game changer, but only for those who get in the game. Thank you.